Bom dia. Muito obrigado pelo
Good
convite para
morning.
poder
Good
participar
morning.
desse
Thank you
evento
for
tão
the invitation to
importante.
be part of this
E é minha
event.
alegria de poder
And I'm very
participar de uma mesa com
pleased
a
to
presença do
attend
Gilney Bastos,
this panel with
presidente da
Professor
Saúde, e o
Bastos
Rodrigo Barroso,
and with Mr.
diretor dos
Barroso,
Laboratórios
the
Braun.
director of
Tema que nos
the
passaram, ele
lab
não poderia ser mais atual.
systems.
A
The
importância
topic
do
to be
complexo
discussed is
industrial da
the
saúde no
importance
momento onde o
of
Brasil
this
vive
complex
pandemia,
industrial healthcare in the country. We
uma
are
absurda luta
having a
política
pandemic,
por conta de fabricação de
political
vacinas
struggles in
e
terms
a
of
constatação da
vaccine
carência de
manufacturing, and we have
independência ou de
shortage
autonomia
of
na produção de insumos
empowerment and
rigorosamente estratégicos
independence
para o
in
setor de
some
saúde.
key and
Gostaria então de
strategic
sugerir
topics
que
in
o
the
Gilney
healthcare
ocupasse os
market.
próximos
I would
minutos
like to give
e
the
passasse a
floor to
visão dele,
Gilney to share
não
his
sobre a
vision,
importância
not only on the
desse
importance
complexo,
of
mas
this
como construir
complex, the
uma
industrial complex or
recuperação de
center
espaço
for
para o Brasil
healthcare, or
nessa área.
how we can build the development for the thrive of these systems in Brazil. Good morning, ladies and gentlemen. And I would like to thank Josias for this invitation. It's an honor to attend this wonderful event. And I believe this is going to help us thrive. And as my former friend mentioned, we have a lot to do in this field. In terms of my remarks, I would like to share with you two perspectives of the healthcare system. First, the current market in Brazil, and then the global market. Both have a convergence among themselves because it's key to bear in mind that the healthcare system is an essential system, and we cannot have error margin in this field. And even then, we place the decision-making process on the hands of the physicians. As my colleague mentioned, we need to try to be independent in order not to suffer in some cases where we have troublesome issues in the market. In the gas market, we supply oxygen for the medical field, but we also manufacture nitrous oxide, laser-based gases, and these are exclusively sold for the hospital setting, and this must be a domestic manufacturing system because we cannot depend on imports for such essential products. White Martins has been established in the country for many years, and it matches perfectly with the healthcare system we have in place. We also manufacture oxygen sites, and we produce and manufacture them. We had some events in COVID pandemic, and we had to face issues in the Northeast, in Manaus, and for this reason, since we have our production sites in Manaus, in Belém, in Fortaleza, in Recife, and Salvador, and with that we had the ability to supply all the gas required to treat those patients. So this was totally different from normal environment, and we always emphasize that with all that we could structure ourselves and deliver everything that was needed in these tough times. And we had our team and the front line working as well as closing some areas, but we had many people working in the front line in order to supply our products and also to achieve our role in the society. And this independence is key when it comes to healthcare. We have the second perspective that I mentioned, which is the medical industry itself. And we know that we have the public healthcare system, which is well established, and that's a development that needs to happen, and it has a high institutional demand in a way. So I believe this should be a reality in all aspects. We cannot have something as sophisticated as SUS. We have demand, we have labor, we have technology, and we were facing cases where there was shortage of masks, gloves, ethanol. So this is not reasonable. We need to have a better understanding because we have orthotic productions, ventilators that were manufactured here. So there is no reason to achieve a level in which we were not able to provide all types of healthcare services required by the medical field in the country. And this necessarily requires a plan, a project in place to face the new challenges in the future in a way to be better serving and supplying the vaccination program. And we will not only need the vaccines, we will need needles, we will need some national manufacturing sites because we have demand in the country and we need to control all that. We need to be attentive to what's going to happen next, and we need to be able to provide a vaccination program and the population, and that's the strategic positioning we need to search for in the future. That was my presentation. Now I would like to give the floor to our chairman. Rodrigo, could you explain specifically how we could be able to evolve in recovering this market that we lost? Thank you. And initially, I would like to thank you for this invitation. I would like to say it's an honor to be attending this event. I would like to greet the governor and Gilney and the audience. And following the same perspective that Gilney mentioned, I believe the pandemic opened up the need of this healthcare complex industry in place. In a tragic way, it showed the level of dependence of our country, and this was well reported by the media. The ventilators example, maybe that was the one that gained highlights in terms of medical devices, but if we think about the ventilators, more than 60% of the ventilators manufactured or in currently used in the country are imported. And many of the components that are used in local ventilators manufacturing are also imported. So the entire ventilator supply chain, approximately 80% of it, is formed by imported components. But we also have drugs with a high level of dependence on imported products. Personal protective equipment, we had a drama. More than 85% of the personal protective equipment being imported, such as the masks. Something that I would like to rectify, and what Gilney mentioned, is our role as players, because we have Barroso, a German company established in Brazil. We operate 3 factories in Rio de Janeiro, but we also work in other regions. And we have a pharmaceutical company, so Braun also manufacture devices, medical devices, infusion devices, other devices, as well as an electrical medical devices site. We suffered a lot during this current pandemic in order to be able to get the electronic components and raw materials to keep our manufacturing production operating, but we could overcome many of the challenges we were able to supply the market. And I believe it's worth thinking about something that I faced over the last months in the company. Braun in Brazil is a leader in automatic infusion systems, which are the infusion pumps. We have a major center of manufacturing those pumps. And we had this rupture in international supply chains of some of the pumps that are imported and currently used in Brazil. And we faced and are still facing some effects of how difficult it is to import components, spare parts of those pumps, because in the origin of this manufacturing of these pumps, there was a peak, and consequently they did not install capacity to meet the demand in all other places. We could help a lot to the healthcare market in Brazil thanks to the local production site we have in place, and also be able to conclude the manufacturing of imported devices. We have national developed pumps. I was part of this project, and I saw during this development how it involves the university and other stakeholders in the supply chain at the industry level, and that's what we mean at the end of the day of this healthcare industrial complex or center. And we have this type, if we haven't had this type of investment in this site in Brazil, we could have a disruption in supply in the market pump in Brazil, and probably would have a more complex situation. Braun also imports some pieces of equipment, and I believe many professionals that are now watching us could notice on dialysis market, we did not have machines available for acute patients, healthcare, critical patients. It was really difficult to supply the market. We are still facing these difficulties, but crisis also raised some opportunities. The need of alcohol here in Brazil developed the ethanol and alcohol manufacturing industry in Brazil. So we had some efforts in this sense, and today we can supply the market with this type of development. And I believe this is an example on how this healthcare industrial center is important, because that's the key element and is part of the solution of an issue which is a critical issue in our economics. The industries connected to this healthcare industrial center employs more than 140,000 employees directly. In other words, it's possible within a certain rationale to develop technology and generate opportunities and development for Brazil in order to collaborate and achieving success in this crisis. I believe the healthcare industry changes rapidly, adds new technology rapidly, and if you take into account the current industries, which are the leading of the 4.0 industries in the healthcare industries, are the leaders in this field, if you clearly analyze how is it possible to have such industries being a vehicle for transforming the research conducted at the academia in products? And we had some examples that were reported during this pandemic. And answering your question, I believe the state level needs to wake up and align itself, so and be the key player in these initiatives. Because we do not mean a policy that needs to be provided for a given sector or an industry, but when we listen to some professors, as Professor Gadelias from Fiocruz, knowledgeable speaker in this field, and it requires proper engagement. involvement, so the installed industries will feel the trustworthiness to invest in such conditions and making it happen, because I believe that's the only way we will be able to supply solutions for the private market as well as for the public healthcare market or system. And since that's a global and universal healthcare system, it cannot be ensured by an entire supply chain that will provide the way for supplying such services. So I believe this should be included in the public healthcare system expenditure, and as well as be a mechanism to help us to face the crisis. And I believe on our side, it's possible. In our industry, we will continue investing. We have some future plans in enlarging the operations here in Brazil, but it all needs to be funded, and we could not have separate agenda. And we have some examples. An agenda of surveillance, healthcare surveillance, which does not match with the pricing control agenda. So how can you encourage one thing if these two fields are not matching? The state should be the key manager and player involving the academia and all the authoritative levels, so these developments can happen in the future. And to conclude, I would like to say that this industrial healthcare system will not exist without the healthcare staff and professionals, because these are the key link in this process, and the level of commitment that we had during the pandemic was fantastic, and I would like to commend all healthcare providers and for their service provided. And that was my perspective for today. Thank you.
Thank you. I think Gilney and Rodrigo emphasize a consensus that we have here in Brazil. The importance of having a health complex that meets some of the demands of the health system. However, especially in recent years, doing it has taken us to some good examples and some bad examples. Why do I say that? This articulation has just served to offer advantage to companies, including increase of price to healthcare system, without having any strategic reason for it. So the very objective question that I have, and I expect you to have an objective answer as well, is how can we really nationalize production without taking us to mistakes and even scandals, political scams, as we had seen in the past? Gilney?
Infelizmente existe uma questão, verdade, enraizada.
You are right. In Brazil, we tend to have this attempt of always trying to get an advantage, regardless of what we do. But at the same time, I think we have evolved a lot as a result of the car wash anti-corruption operation, and things are getting better to some extent. For example, the social organizations for health, which are a good idea, have really been translated into something much more complex, which is sad, I have to say. But we shouldn't allow to happen with health what has happened to the industry as a whole. 20 years ago, we used to have 30% participation or share of the GDP of industry. Today, it's only 11%. And why is that? We are not a country of 10 million people or 20 million people. We have 220 million people. There is a demand. If we have a sophisticated universal system that intends to take care of people, this is where the demand comes from.
contínuo e
We just
estável
have to
para a
have
saúde
constant,
e que esse
stable
custo
flow
seja
to
aplicado de
health,
forma conveniente,
which is
obviamente.
applied
E
conveniently,
entrariam os atores também, aí nesse sentido, os atores de fiscalização, mas não
involving
pode ser
also
diferente. Se a gente tem
fiscalization
demanda,
and
se a
other
gente tem
players. So if we have a
consistente,
demand, if we have
o
consistent
desenvolvimento
flow,
ele vai se manter e vai até melhorar.
development should be maintained and even improved. This is what I thought.
Rodrigo,
Ok.
como estimular sem estabelecer proteções inconvenientes?
How can we do it without putting in place
Acho que esse é o grande
inconvenient
ponto,
protection?
que é
Very good point.
sempre aquela discussão, né? A diferença entre o remédio e o
The,
veneno é a dose, né?
the
Eu
difference
acho
between a
que
drug and
realmente
venom is
é
the
ponto
dose.
super válido o que o governador coloca.
What you are saying is
Na minha
really
visão,
important.
acho que
In my
eu acredito
opinion,
realmente é a ação do Estado, é a ação
I believe
articuladora
in the
e é o
action of the
diálogo,
government
governador. Eu
and
penso
also always
que existe esse
encouraging
risco, esse
dialogue,
risco tem na
conversation.
mesa. Eu acho que o
There
Estado
is a
ele tem que
risk, it's a given,
ele tem que advogar
but the
nesse sentido,
government
de evitar
has
excessos,
to avoid
mas o que a gente não pode
excessive
talvez
actions. But I
por
don't
alguma
think
lógica ideológica, algum outro tipo de coisa,
we
também
should
frear
prevent
alguns movimentos e
movements and actions
algumas
and
iniciativas que
initiatives
pode ser sim muito proveitosa
which can be
para o país. Eu
very
acho que dá para você
successful
entender. Eu acho que
successful
hoje
to the country
a
if
gente que
we
lida muito
have good control over
perto, né,
them.
com os órgãos reguladores,
We work
a gente
very
vê o
closely
preparo
with the
desses
regulatory
órgãos, a
authorities
informação
and we
desses
see
órgãos. Eu
how
acho
well
que
prepared they
hoje a
are.
informação está muito mais disposta, é muito mais
Information
fácil hoje você entender
is
o que acontece
it's much
no cenário
easier to
internacional, quais
understand
são
what
as
happens in
práticas,
the
quais são os
international
interesses, quais são
scenario,
os interesses. E
practices,
eu acho que dá para,
prices, interests,
dentro de um canal de
and
diálogo
within a concept
forte,
of
né,
dialogue and understanding,
você conseguir articular tudo isso de
we
forma
can have it all
a buscar o
articulated
benefício.
and
Porque
provide
se a
benefits.
gente também ficar limitando esse tipo de ação, a gente
If
também
we
não vai
limit
sair do
this kind
lugar e
of
daqui a
action, we
10
are
anos
getting
a gente vai
nowhere.
estar aqui discutindo a mesma
Within the
coisa
next 10 years,
em
we'll be
cima de
here
não
discussing
sei,
the
de um
same
cinturão de
thing
ferrugem dessa indústria que agoniza
without
realmente. E
really
é
succeeding in
estratégica, não só
solving
pela
it.
lógica da defesa, mas pela lógica realmente do desenvolvimento. Eu acho que é essa a
I think we
agenda.
have
A
really to
agenda tem que
encourage
ser uma
development.
agenda de
This should be the
desenvolvimento. E essa
agenda,
indústria
the
é um
agenda
motor, sem
of
sombra de dúvida, para
development.
isso.
And
Minha opinião.
this industry is an excellent driver for it.
Uma outra questão que me parece interessante,
Another interesting
da
question,
sabedoria da experiência
and
de
I think it
vocês,
would be good to hear your experience on it,
o complexo
is the
industrial da
following.
saúde, ele, do ponto de vista,
A health
na minha
industrial
opinião,
complex,
correto,
in
bom,
my
ideal,
opinion,
tem que buscar uma autonomia brasileira
should be
não no que
autonomous
já é
in
dominado,
Brazil, not in what
não nos
already
aporta muito
has been
tecnologicamente passar a
dominated.
produzir
I mean, it
as
would
máscaras.
be of
Não tem
no
necessidade de
avail
mercado, mas não
producing
agrega do
facial
ponto de
masks.
vista
Yes, there
do
is a market
desenvolvimento
need, but it
científico e
does not
tecnológico.
have help in terms of
Como
scientific and
orientar,
technological
estimular
development. So how can we
essas
encourage
parcerias
partnerships
com o foco em participar da
and always
geração do
focusing
novo,
on
não da
generating
reprodução do
new
velho?
things and not
Nós apenas
reproducing
nos
old
ajustar
stuff?
a produzir o já
If we
existente,
are just willing
nós, a
to
cada 5
manufacture
anos,
what has already
estaremos
been
de
in
novo
place, every
ferrados.
5 years will go
Como fazer
outdated.
parte do parto do
How
novo,
can we be
em vez de
part
ficar só
of the
batizando
new
os já nascidos?
elements rather than just keep on reproducing what
Eu
has
acho,
already been done?
eu acho que é um ótimo ponto. Se
Very
me
good
permite
point.
comentário nessa direção, é realmente pensar sistemicamente,
I think we have to think
pensar
systemically,
sistemicamente no sentido de entender que a universidade
understanding that the
pode ser sim
university
elemento
can
para
be
tocar essas
an
pesquisas.
element to
Pode existir
lead
parcerias entre
research.
indústria e
There might be
universidade para
partnership
fomentar isso.
between university and industry to
E eu
encourage
concordo,
that.
não é só reproduzir
And you are right. It's
essas
not
coisas
only
tecnologicamente mais simples,
reproducing
mas a gente precisa
technologically
avançar numa agenda
simple products. We have to
desenvolvimento
move ahead
tecnológico.
in terms of
E
technological development.
para mim, novamente, é somente o pensamento sistêmico e enxergando todos os atores
And I think
desse
that
sistema e não
if we
indústria
see
e
all
setores
players
isolados,
not
que é o caminho para a
in
gente
isolation,
desenvolver.
we'll be able to develop that.
Exato, não é estímulo que nós estamos. Exato. Obrigado. Não é estímulo que precisa. O que precisa
It's not an encouragement that we need, I think. What we need is organized management, a project of what we want to do that has a financial flow in health system which is consistent and constant. By doing that, we can do anything. We have technology, qualified headcount. I mean, it can happen if we have a plan, stability. Whenever there is consistency and knowledge, things are going to happen.
Estou plenamente de acordo.
Couldn't agree more. Well, I was told the only thing I have now time to say is thank you. So thank you. Thank you very much. Thank you. It's been a pleasure to be here with you. Thank you.
Abraço.